The question was, I want to have a party at home. What do we do about that? What is the preparation I should do as a good host? And I'm going to get Sandhya in here because I wanted to talk about, it's going to be hot. So when do I switch on my aircon and when I should switch it off? Should I leave it on? Sandhya?
Okay. Excellent question. Yeah, look, this is, and I've done a video on this if you want to look. It's on my YouTube, which is the last talk I did with Primla, which is managing risk in a living with COVID world. And everybody has to understand that there is no such thing as zero risk anymore. But by using the multi-layered strategy that we have available to us, and I would say that you have to think of it as a vaccines plus approach. And the countries that have done the best with managing COVID and getting back to normal life, you've got to look at countries like South Korea and Japan, where despite, this Omicron being omnipresent everywhere, they've actually managed really well. And where they have managed would come down to the fact that they have excellent discipline with things such as masking, which, as I explained to you, not only does it protect each other, it is in our best interest to reduce on every occasion the number of COVID aerosols we are inhaling, because a reduced dose correlates with a less severe infection. So, and the other thing to remember is that it's not a case of, okay, I'm out to get my Omicron infection and then I'm done with, because in many countries people are getting infected again and again and again, second or third time, and within a short frame, like 4 weeks later. So unfortunately, it's a new normal that we have to embrace. Number one, when we look at our vaccines, so it's vaccination, number one, and getting your booster as soon as possible. So if I'm having my party, first of all, I want to know that the maximum number of people who I'm inviting are vaccinated, if they are eligible to do so. And if there is anybody that's vulnerable, then I need to know. Number two, if you're having a party, you don't necessarily want to, you're going to be eating, so masks are going to be a little bit difficult. So if you can have that party outside, have it outside, because it's all to do with, dilution of these particles with fresh, filtered or flowing outdoor air. So fresh air means having first of all, being outside is better than being inside if you can. If you can't be outside, then having as many windows and doors open and ensuring cross ventilation. When it comes to your fan, just a little fan like this pointing out, so the fan is pointing, facing out the window, will help with cross ventilation. In terms of air conditioning, you do not want your air conditioning mode on recycle internal air, because that's going to increase your risk. Now, there's two different types of air conditioning units. You have your HVAC, which is heating, ventilation and air conditioning. Those units, you can actually use ventilation, but other just standard home ACs don't have that. They tend to, recirculated internal air. So it's always preferable. I mean, you could have the AC on, but you'd want to have the windows open as well. Even if it's winter, even if it's cold, even the UK did a ad campaign where they said opening the windows for even 10 minutes every hour will help reduce the viral load of that actual room. So you've got to imagine everybody's releasing this fine spray. Okay, this is just some Glen 20, which will help clean your surfaces, which is good if somebody's actually infected. But rather than madly cleaning your surfaces, you've got to shift your thinking into cleaning shared air. And I think there hasn't been enough on these portable air purifiers, which, are affordable. You can use in your workplace and at your home if you've got a party and you are inside. They are effective in filtering 99.97% of viral particles that are emitted in a room. So they are an excellent extra layer of protection and will protect everybody. And it's not just, and clean air is not just about COVID, it's about all sorts of illnesses. I mean, to be honest, in the last 2 years or since the pandemic, I have not actually come down with a viral illness, touch wood. Whereas every year when I was practicing, when I didn't wear masks, I would have a terrible infection at least once or twice a year, because we just purely didn't, that purified all those, viruses or bacteria that I'm inhaling when I'm examining people in a small unventilated room. Now I see patients, I have my mask, the patient has their mask. The window, I have an open window, plus I have an air purifier, which the air purifier placement is best away from a window in the area of the room where there is, less, clean air that's coming in.
Thank you.
Yeah, these are really important tools. So we don't have to feel like, we're powerless. There is a lot in our power.
Wonderful.